Hello everyone, this is Dr. Anam Zahir and another beautiful Sunday, and we are back with our another episode of Instagram Live, episode 22 of Guest Talk with Homeopathy Heals. And yes, as promised, we are back with some talk, with some more questions, breakthrough regarding the mental health. But this week, the topic is a little bit different. We'll be talking about child mental health. So I welcome you all, and I'll add our guest of the day. Okay, I hope ma'am will be here. So ma'am has joined. I would I would request Miss Rahi to please send us a request to be in the video. That would be more. I think Instagram should come up with better solution for this. The hide and seek of inviting guests. Hi all, those who are waving hand. Very, very beautiful noon to you all. I'm so glad we all are here again.
Hello,
Hello, very good afternoon, Miss Rahi.
good afternoon, doctor. I think Instagram again did something. So it was taking a while. I don't understand. They definitely need to fix it, like you said. It's a very
Yeah,
reoccurring issue. Does this happen often in
yeah.
your life? Like it happens a lot when
Uh,
I host lives, but
no, at times. When the
okay.
guest is not well versed with the Instagram.
Well, then that is definitely me. That is definitely me. Really bad with tech.
Okay, so before we start the session, I would like to introduce our guest of today. She is none other than Miss Snowy Rahi, and she is the founder and owner at Sit with Rahi. And very soon off lately, I was there as a guest. She's a counseling psychologist and she's a certified emotional wellness coach. She did her master's in clinical psychology and is an organizational behavior. Ms. Rahi did her BA honors in psychology and was awarded as All-Rounder Achievement Award from Aligarh Muslim University, Uttar Pradesh. She holds a specialized PG diploma in guidance and counseling, and she makes do a lot of try to do a lot of teletherapy services, and very currently associated with ASCC as a senior research analysis and Minds Infinity as a consulting psychologist and career counselor. Again, welcome to you, ma'am.
Thank you so much for an elaborate introduction.
I have a question before we start.
Please.
You look so young and you have achieved a lot. How?
Good question. Well, I loved multitasking. So a lot of it I did that way. So I started really early. I started in my, once I was sure that I wanted to get into psychology, and I think that is one thing that a lot of us can do. I started in my final year of MA with a lot of things. I figured out how can you do things that will be recognized if you do them simultaneously. A lot of it I did because of COVID. I got an opportunity to do it either from home or virtually, and I did get certified internationally for some of the courses that way. Did a lot of volunteering work, but it's like extra hours. You need to find extra hours in your day. So it's not just normally people do it college and then they step out of it. I did college, then I worked after college hours, so it was like that, like you do in your practice,
Okay.
which we don't normally do otherwise. So when a medical professional is preparing, you are either on campus or off campus, kind of
We are on duty.
working,
Yeah,
interning. So I
very
did the same thing, but it works out well, and I'm not that young, so with my age, it's fine.
true. Okay. So today's topic is, uh, child mental health, not a
Mhm.
destination, just a journey. So, why you have selected this topic?
Well, that's a very, very good question, doctor. So, like the other day, we were having a conversation about this, and there are certain topics which are not emphasized upon. And, children are, we were kids once, and now we are adults, and we know that agar bachpan mein certain things would have been taught to us, whether you or me, things would have been very different for us health-wise. We wouldn't have to learn a lot through trial and error that we're learning right now, and unlearning so much. We have to learn years and years of things that we learned, and now we know, oh my god, this is wrong, we're doing it all wrong. And then we start blaming some of it to our parents, our adults who were there, and it's very natural. When we are down, we feel like उस टाइम पे ऐसा बता देते बड़े तो अब हम ऐसा नहीं कर रहे होते, kind of a thing, right? So now that we are here, we have the opportunity to talk about things that the next generation will not have to face, and even the young parents who are raising this generation. So I think it was very, very important that we discuss this topic. And like you rightly mentioned when we were discussing that, let's talk about it. And you did point it out, it is important. And there are a lot of cases that you yourself see in your practice where parents are either worried, समझ नहीं आ रहा है क्या हो रहा है, or, and with the child, the communication is definitely a bar most of the time. So absolutely, I thought that we need to talk about this.
I have a question to raise, and I think many of us would relate. I belong to a brown family, Indian family, middle class family, and even I talk to my closed ones, people, my parents, that I'm feeling low or I'm not feeling well, being as a kid. So what replies usually we get from our parents, ऐसा कुछ नहीं होता है. It's nothing like that sadness. You're too little. अरे 8 साल की उम्र में टेंशन, 10 साल की उम्र में stress. So I would like to know, Ms. Rahi here, what is the difference between mental health versus mental illness, and can kids have mental issues as well?
Right. That is a brilliant question. Thank you for asking. And you're a brilliant host, so of course. So questions like these, it's actually very true. Kids can have mental health issues, and they do have mental disorders. So there is a difference. First, let's understand what the basic difference is. So mental health is when your day-to-day life is disrupted, and you are seeing that, okay, for example, your child is, or you yourself are sleeping in a bit too late, or you feel like there is no time management whatsoever, and that could lead to stress and anxiety and other things. Now, mental disorders are classified. We have a certain, like in any of the disease, a disorder, we have classifications, we have symptoms. For example, in depression, a person would have to have like more than certain amount of symptoms for a duration of over 2 weeks in order to be classified as a, it to be classified as depression, as a disorder. And we follow DSM and ICD. In India, we normally follow ICD, yes, because that is what, that is what is followed in Britain. In college, you are taught DSM, so that is a little bit of discrepancy that I felt. But eventually, in masters, you kind of come around after your internships and everything. You realize. So with mental disorder, it has to be classified. So you have to have certain amount of symptoms for a longer duration of time. Whereas in mental health, that is not the case. But again, that still means that there is a disruption in your day-to-day schedule. You're not able to do things properly. For example, agar aapka bachcha hai, now I'll tell you. Now suppose you said something कि ये मत करो, and then the child starts throwing a tantrum. हम बोलते हैं ना कि एकदम लेट गया जमीन पे, उठ ही नहीं रहा है. Very common, very common. Now the child normally does that, and the parents think either they discard it as like बदतमीज है, it's like bad behavior trait, okay, or they are like ये तो करता ही ऐसे है, ये तो करती ही ऐसे, let's just ignore it. Cover up. They don't address it. Now that is where the parents go wrong. You don't know why the child is throwing the tantrum. The child could be wanting some attention. They might be feeling that. A lot of time children do this when both the parents are working. So they develop a sort of separation anxiety. They don't want their parents to go away. Yesterday night, I'll tell you, doctor, I was invited at a neighbor's place, like very close by, for some dinner or something. And she told me that her child would not let go of her. So whenever she was out of sight, he would start crying a lot. And he is, I think, 10 months old, 10 or 11 months old. And at that time, she asked me, but I didn't want her to tell her then. So she's a working mom, she's not around. Like, I don't understand, he just keeps crying, he cannot leave me alone, he wasn't like this. That is something to recognize as separation anxiety. The child is worried कि मम्मी गई है तो अब आएगी, and I cannot stay away. So you have to, in terms of child psychology, mental health, the parent will have to be more well versed as opposed to the child, because they exhibit their behavior very differently than how adults do. You and I can say that घबराहट हो रही है, अच्छा नहीं लग रहा, रोना सा आ रहा है. They will just say, no, I don't know what's happening, but I'm going to break this toy right now.
Right. Yeah.
So
Or
that
just
is
throw
the
it off.
or just throw it off.
Yeah, throw it off.
They
Yeah.
act out.
Very true.
They definitely act
Yeah.
out.
So, according to you, kids do have mental health
They do.
issues, and this topic need to be considered, especially from the part of the parents. Is it?
Absolutely. From the part of the parents, from the part of health professionals, be it mental health professionals or medical health professionals. But I think that in our community, professionals are well versed. It's the parents who have a little difficulty in accepting what's wrong. So if the child has any physical ailment, bukhar hai, so they would rush to the doctor. But if the child is
Doctor.
constantly complaining of stomach ache, they try to first do these home remedies and take a long while to ओके ठीक है, दर्द हो रही है पेट में, या समझना ही कि पेट में दर्द हो रही है. They take a lot of time because it's not visible. So it's something like that.
True. And it's a very common and usual to take ibuprofen plus or any antipyretic drug at home, but it is very difficult to take a kid to a therapist or a counseling
Right.
person. I know.
That's true.
And I think it will take more a decade or a two for a parent.
Absolutely.
Yeah, unless
well
the
aware.
90s kids will become parents.
The parents.
And then, yeah. then it
Maybe
will
then we can hope some change. Otherwise, yeah.
Yeah. So we addressed about that. Yes, kids do have mental illness. Ma'am, can you tell us about some common mental health illness which are very
Right.
much prevailing among the kids?
Absolutely.
What you experience in your practice?
Right. I think that it's common. I'm very sure you would agree with me on this. Kids experience anxiety issues. They have proper anxiety disorders. Very common. Kids deal with PTSD, post-traumatic stress disorder. Kids have ADHD. They deal with attention deficit hyperactivity disorder. They can be diagnosed on the spectrum, that is ASD, right? They can be autistic. And there can be depressive symptoms too. Given the current situation after COVID, grief and loss is something which has again become very prominent, because there are kids who've lost both their parents. What do you do then? How do they process it, right? And even if a child has lost one parent or a caregiver, then again, they could get into that state. So we cannot eradicate the fact that these mental disorders cannot be classified among kids. But the unfortunate part is, most of the time, and schizophrenia, of course, schizophrenia is there too. But its onset is on later teenage state and early 20s, adolescence, right? But since we're talking about kids on a whole, so I thought I'll take the minors here too. But most of the time, the unfortunate thing is that it goes undiagnosed, and more in females as opposed to males. So female children live a really major portion of the life without getting diagnosed for ADHD as well as autism, surprisingly, as opposed to a male child. And statistics are the same.
What ADHD?
लड़कियां तो होती हैं, right? Exactly. You said it so beautifully. Exactly like that. So ये वाला, and recently I was reading a post about a medical professional. She's a doctor and she has ADHD, and she was telling her ordeal about how difficult it was growing up because parents constantly expected so much. And she did not know how to process it. Now, and her teachers would constantly punish her for, you're too talkative, you're too jumpy, you're too this, you're too that, without being diagnosed. And she got diagnosed at the age of 30 that she had ADHD. And her brother also had ADHD, but got diagnosed in class 8, changed schools, and is doing much better now because he got the treatment that was required, or the kind of conducive environment. In terms of mental health and mental illnesses, conducive environment plays a very, very strong role. So he got that, and now he's doing very, very well because he got to change schools, his teachers were informed, his parents treated him differently. So that is very unfortunate. And she's a medical professional. She got diagnosed now when she consulted a psychiatrist that something is wrong. I don't know what it is. So at the age of 30, she was diagnosed. So that is,
late diagnosis have very poor prognosis. Yeah.
Very. Absolutely. So with kids, of course, we have to be cautious. And with ASD, again, females are diagnosed way less as compared to male child because they exhibit their the kind of the recognized symptoms a little later. So let's say ASD ka onset normally is 3 years and above. Kyuki the developmental cycle that is there, the criteria that are there, a child is not able to complete their developmental milestones. And that is where the parents are concerned. कि अरे अब तो 3 साल का हो गया, अब तो इसे बोलना चाहिए, ये बोल क्यों नहीं रहा, है ना? So then they'll rush to the doctor. Or he's just sitting and doing one particular activity. ऐसा लग रहा है कि सुन नहीं रहा है. So is there something wrong with his ears? And then they'd realize, no, he's just not interested to acknowledge that sound. Right? So
is that a
these are
mental
the
disorder
things.
as well? I have seen a lot of kids.
ASD, yes.
They don't listen.
They don't. It is. It could be early signs of autism. So with autism, and that is why I think they made it on a spectrum as opposed to a particular disorder. So when you're on the spectrum, every person will be have a different neurodivergent capacity on its own. So unka brain function will be very different. So there are severe cases of autism that lie on the higher end of the spectrum. And then there are very mild. So it's also called cute autism. I just recently found out. It's called cute autism because they do these cute things that they have rituals, or they like to correct you on certain things. Or so now people have started calling it as cute autism. So on the spectrum,
now even autism is cute.
Autism is cute. So that is what there is. So it's on a spectrum. So with autism, you'll have to be very, very cautious. And I think that is why the diagnosis takes a little bit more time. And with female, they in general say that the developmental stages are achieved either later or take some time. So, it goes undiagnosed in a lot of cases for a really long period of time, like till the age of 13, 14 or adulthood. Unfortunately.
So, okay, we have talked about so many mental disorders we have in kids, but you are a professional, okay? You are a therapist. So what are the signs we should look for among the children to find out whether they are having mental health issues?
Right.
Like we have in fever, we have headache, the red face, babies crying, like we have in physical symptoms, na? Abdominal colic, babies crying with fist closed. So is there any signs and symptoms that we can check for normal and abnormal?
Yes. So there are actually. So this is a very common problem and you would have encountered in your practice a lot. बच्चे के पेट दर्द हो रहा है और रोना नहीं कम कर रहा है. ये इन्फेंट्स में बहुत होता है कि पेट दर्द हो रहा है. And if you'd go for a lot, so most of the times it's something regarding the physical anomaly. But most of the time what happens is a child, when facing stress or anxiety, they exhibit it through stomach aches. So their stomach will start paining. In a very tiny infant, like 10 to 12 days old, a month old, they also express stress and anxiety through clenching their fists. So, swaddling is something which is advised at that time. कि आप अपने बच्चे को wrap करो पूरा and hug the child close, because the child has a similar feeling of being in the womb. So child misses that environment and then experiences separation anxiety. Okay, I am not in the same environment that I was in. Right, and this is a part of developmental psychology only. They have these intensive care these units now in hospitals for children who experience certain separation anxiety issues when out of the womb. And that is why I think I read a study also now that when a child is born, now they prefer to keep it on the bare chest of the mother born, so that the child has a sense of security that that is the only smell the child can recognize instantly. So the child does not feel like, oh, I don't know where I am, I don't know what is happening. And this has reduced a lot of mental health issues that the child might develop further in life when it comes to stress and anxiety. So like I said, if the child is like always holding their fist, this is for infants, okay? Or if there are constant complaints of stomach aches in toddlers, who can say कि मम्मी नहीं पेट में दर्द हो रहा है, and then you ask बेटा कुछ खा लिया, या do you think that your stool is not proper, do you have loose motions, what is happening? And the child is नहीं, सब ठीक है, बस पेट में दर्द है, ठीक नहीं हो रहा. Then you should notice, are there fights in your home? Is there a discord between you and your husband? Or if you're a single parent, do you exhibit the stress at home? So at this time, child is very prone to absorb and imitate that. Now they don't know how to express it as stress or anxiety. But they can very well exhibit as a physical symptom, and in majority of the cases, doctor, they exhibit it as a physical symptom. So they'll either stop eating, their eating cycle will be disturbed, their sleep cycle might get disturbed like an adult, right? But for it is again the duty, or the, if you care for your child, it is a part of the parent that they'll have to play in recognizing, oh, this is a little odd. So if their child is a person who is very active, who was very active, and suddenly is not doing anything, does not feel like talking to people, does not indulging in games, then that is a point of concern. Okay. And if their child constantly complains of stomachache, notice when are they complaining about the stomachache. Is it right after you've had a fight with your partner, or you're yelling on the phone, or you yelled on the child, or is it abruptly at odd hours? So those are certain cues that an adult would have to notice and take into consideration कि नहीं डॉक्टर ये सिर्फ तब बोलता है पेट दर्द का जब या तो मैं ऑफिस से आई होती हूँ या मैं ऑफिस जा रही होती हूँ. So we notice that अच्छा हो सकता है सेपरेशन एंजाइटी की वजह से बच्चा एग्जिबिट कर रहा हो, right? And depression के cases are not very high that I have seen as of now, but they could again develop now that we are seeing that the child is losing both the parents and does not know. Again, pura new environment, they don't know what to do, they don't know who to consult, what to say, how to express their emotions, things like that. So with kids, you have to observe these cues, and they would absolutely complain of physical distress and discomfort. They would not tell you that मन अच्छा नहीं हो रहा है या बात करने का मन नहीं. They would not do that. They'd either shut themselves out and you'll constantly ask बेटा क्या हो गया, and they'll be like कुछ नहीं, because for them they don't even realize that they're doing, right? So at that time, that is a point of concern. As soon as you realize that there is a behavioral change in your child's behavior, as long as you realize he's constantly complaining of a physical ailment even when there is nothing wrong, consult. First you go to your family doctor, your pediatrician, and then absolutely consult a mental health professional after that. So those are certain things that are there.
Okay. Can we take a little bit of audience questions?
Yeah, sure, absolutely. Why not?
Okay, there's a question, ma'am. What if children has a low perception? Is it a disorder? Means child behavior immaturely according to his age?
Well, it could, if there is a developmental delay, this would come under the developmental constraints. If there is a developmental delay, please do consult your doctor first and foremost. If you have a family doctor, consult your family doctor, because developmental health is something that everybody studies. I don't think that there is any medical profession that does not study developmental stages of a child, right? So we also study the biological aspect as well as the mental health aspect, because cannot exist separately. Unfortunately, cannot. Without the biological growth, we do not know at what are the age demarcation if we do not know the developmental cycle. So if that is something which is happening, I would absolutely recommend you to consult first your pediatrics and then also mental health professionals, because if there are developmental delays, then they need to be assessed, because it could be a sign of various form of disorders. It could be a sign of speech delay, or it could be again ASD could be there, ADHD could be there. There are various other things that could be happening, or it could be nothing, and you might actually just need to pay attention to your child, and they might be just craving that extra care. And if you provide them with that okay, I'll sit with you, and if you don't understand this mathematical question, let's do it together. If you don't understand the concept of maths, let's do it together. There are so many learning disabilities that are there, learning disorders. That could be a problem too. So absolutely, consulting at that point, I think, is very, very crucial. Delaying it should not be an option. If you have the capacity, definitely go out and consult a mental health professional or a medical professional. Both of them will be able to guide you at least on the first few steps.
Yeah, I have seen parents being so much ignorant to the behavior of the kids. If they're not sitting, to a certain place, not drawing properly, not able to write the alphabet, they just say, हमें कौन सा minister या collector बनाना है, सीख लेगा, he's just 5, she's just 6, है ना? So I have seen parents. So those who will be, or this video or this live will be reaching to the common people, please look for the behavior of your kids. So another question we have, Dr. Mona is asking, Doctor, please cover the topic of COVID situation and kids' mental health, where they are totally isolated and they are not allowed to play or go school.
Okay, right. Very good question, and I would love to address that. I was actually hoping that somebody would ask it, or I would address it at the end. So, if there are kids who are like siblings, then it's they have somebody to play with. But if it is an only child, that is a little bit of kind of a debarring situation. in terms of COVID situation because they don't have a playmate. The good news is, as of now, what the research is coming out, that the social development of a single child or siblings is not very different. They still develop fine. Their social development does not get hindered. But with COVID situation, it is a little bit more challenging because they're also not meeting their friends, right? At this time, what a parent can do is that have a corner in your house, even if it is a 1 BHK flat, have a corner, place a mat, put some toys, and make that like a calm corner or a discussion corner or a play corner for the child. So the child has a space first. Second, make some time to, kind of set aside times that, okay, this time we'll play, this time we'll study, set a routine. It is important that your child has a routine. Without routine, that's like the basic step. If you don't have a routine, any of the solutions that you ask for will go down in vain because they cannot exist independently. A routine is an absolute must, which means that wake up your child, ask them to go take their bath, and then, kind of have breakfast together. At least try and have the 3 meals together. If your child is too, like kind of a baby, is an infant or a toddler, especially a toddler, pay attention. If a teenager, then also pay attention because they might be going through different sort of issues altogether. Okay? Try to be attentive. So now active listening is a very important part here. If the child is like 4 and above, 3 and above, they will be able to communicate some parts of it. They are a teenager, they'll definitely be able to communicate a lot of it. Pay attention, listen to what they're saying as opposed to just replying without understanding what they're saying. So your child would be like that, Mama, I need to spend some time with you. Or Papa, I would like that. Thoda sa saath mein khelo na about this. So you're just working on your laptop. You're just working on your laptop. Hai na? As soon as you get a 10 minutes ka break, do this for yourself and them. It is a very, very good de-stressor if you engage in any sort of physical activity. So maybe just sit with your child and be like, okay, what are you doing? You're playing a game. Let's play it together. जितनी चीजें आप साथ में करोगे ना, उतना ज्यादा उनको आइसोलेशन कम फील होगा. They'll be like, ठीक है, दोस्त नहीं है तो क्या हो गया? Your connection with them will also grow strong. So they consider you as somebody who's a very, very trusting figure and they can come up to you if something is wrong. And this is also important in terms of, we see a lot of child sexual abuse cases in terms of post-traumatic stress disorder. Now, most of the time, children will again complain that इस relative को मुझे hug नहीं करना, इन भैया के पास या इन दीदी के पास मुझे नहीं जाना. And you'll be like, क्यों नहीं जाना? जाओ जाओ जाओ, बैठो बैठो गोदी में बैठो, hug करो, अरे ऐसे कैसे इतने टाइम बाद मिलो. Listen to your child. If your child is saying they don't want to do it, do not force them to do it because they would shut you out completely after that. And then would definitely blame you when they grow up, and rightly so. So listening to your child is very important. Spending time with them is very important. Acknowledging that and explaining them when they are asking COVID क्या है, क्यों हो रहा है, सब घरों में क्यों बंद है. Answering their questions is very important. So you have a stronger role to play in this than anyone else as a parent or a caregiver. I hope that answers your question.
Oh my God, that was so lovely, so divine. You have beautifully summed up everything. So, as a therapist, what is the course of treatment for this if a child or a toddler comes up with the mental health disorder or an issue?
Okay, right. So what we do is first, of course, we'll have a session. I'll just explain briefly how the session works. So you would go to a mental health professional and you would have first a session with the professional because the child is a minor. Adult supervision, consent, both the things are required. Otherwise, the professional will not take it forward. Simply because the legalities are too intricate and complicated. Nobody wants to get into that, right? So first we'll have a conversation with the caregiver. Most of the time the issues are with the caregivers, unfortunately. And the child is just acting out because of it. Because they're like a sponge, They observe everything, whatever is around them. Whatever you give them, even without knowing. So if you should notice this. If there is a mother who likes to dress up, the daughter or the son would like to dress up all the time. Irrespective of their gender, till a certain age, there is gender curiosity that is there. They want to know what this is. So they would just copy it and then they would, most of the time they'd find their own rhythm and move on. But they would copy you all the time. And it is irrelevant or it is kind of ignorant to think that they would not copy your mental processes. The way you are feeling, they feel the same way too. So you'll have a conversation with the mental health professional as a caregiver and an adult. Then we'll have another session, or then we'll have a conversation rather with the child. कि, there are certain questions that the professional would ask. कि बेटा अच्छा आप घर पे क्या करते हो? Basically about the routine, and would try to ask it in as simple language as possible, because बच्चे से you cannot ask technical terms. Then we would observe the behavior कि बच्चा बैठा हुआ है तो हाथों से तो fiddle नहीं कर रहा, नजरें उसकी नीचे तो नहीं है पूरा टाइम, और is he looking across इधर and उधर, है ना? These are behavioral cues that a mental health professional will notice, right? Then again, अगर और कोई caregiver है, would like to talk to them. Talking to the teachers would help. उनका input चाहिए होता है कि अच्छा घर में ही ऐसा behave कर रहा है, but school में कैसा behave कर रहा है ना? क्या discrepancy है behavior में? और अगर नहीं है, constant है, तो ऐसा भी हो सकता है कि बहुत से बच्चे introverts होता है, personality type ही ऐसी है. Parents हो सकता है extroverts हो, but बच्चा introvert है ना? So that is also then you have to rule out everything. Like in a medical condition, you try to rule out every possible cause to find the correct one, right? And that is why you have a detailed case study. So basically, to sum it up, we do take a detailed case study which would involve all the people in the ecosystem. We call it the ecosystem of the child. So the first-hand people that are there could be grandparents, parents, teachers. Could also be the पड़ोस वाली आंटी जिसके साथ बच्चा टाइम ज्यादा स्पेंड करता है जब मम्मी ऑफिस रहती है, हो सकता है. I had a friend, she would come over to my place because her mother was working, so after school till a really long duration of time she would stay with me. So now my parents would also be first hand caregivers क्योंकि वहां पे क्या हो रहा है would also come into consideration. And after that we would recommend if some tests need to be conducted in terms of recognizing if learning disabilities हैं या developmental delay है. And then the course of action is decided, because in terms of learning disabilities, specific professionals would be recommended to you. जैसे speech therapist हो गए, since they specifically work in terms of speech therapy for children or adults, right? So that is where you decide the next course of action. कभी-कभी पेरेंट्स की काउंसलिंग करना ज्यादा इंपॉर्टेंट हो जाता है. बच्चे को प्रॉब्लम तभी सही होगी जब पेरेंट्स की प्रॉब्लम सही होगी. So that is also recommended that no, maybe the child absolutely needs to be addressed, but your issue needs to be addressed too. क्योंकि जब तक you won't resolve your anxiety, your depression, what you are going through, तब तक बच्चा तो सही नहीं हो पाएगा, right? So that is one thing that is there which happens. So that is the course that we normally take. But even before that, what parents should normally do if they raise kind of a red flag is that please consult your medical professional as well. Go to your doctor एक बारी and have that conversation, because like I said, your doctors are trained. They can also recognize basic outline that something is off and consult a mental health professional. Okay. But yeah, if you directly know a mental health professional, absolutely go to that person, because if it is a physical ailment, they would direct you to a medical professional. Doctor. They will not be like, नहीं हम ठीक कर देंगे, ऐसा नहीं होगा. So at least you'll have a channel. You'll have a right channel, which is very important, to have a right channel in terms of getting the treatment. And symptoms, like I said, I just sum it up quickly. अगर कोई फिजिकल एलिमेंट की वजह से मेंटल डिसऑर्डर हो रहा है या मेंटल हेल्थ इशू हो रहा है, डिसऑर्डर तो नहीं, दैट इज आल्सो पॉसिबल. योर चाइल्ड इज गोइंग थ्रू अ ट्रीटमेंट, अ वेरी कम्बरसम टायरसम ट्रीटमेंट फॉर अ रियली लॉन्ग पीरियड ऑफ टाइम एंड इज जस्ट टायर्ड विद लाइफ. ऐसा भी होता है. बच्चों को भी काफी चीजें ऐसी होती है जो कि मेंटल हेल्थ, क्रॉनिक मेंटल हेल्थ इश्यूज, मेडिकल इश्यूज हैं, क्रॉनिक इलनेसेस हैं. उस टाइम पे भी इट इज एडवाइज कि प्लीज हैव अ काउंसलर अलोंग, क्योंकि हाउ द चाइल्ड इज डीलिंग विद दैट क्रॉनिक इलनेस इज इम्पोर्टेंट, है ना? The child might not want to cry in front of you and express it in front of you कि मम्मी पापा भी रोने लगेंगे और नहीं करना चाहते, and then बुरा लगेगा, they try to mask it. So even when your child is going through a chronic illness, it is advised that also have a mental health professional alongside your doctor, so that they can work to the best of their capability, so that your child can overcome it faster and better.
Okay. So what parents or caregiver can do from their end to make the situation even easier for them and for the kids? If there's a problem, there should be a solution, right?
There should be a solution. Well, a lot. I don't know where to start, but they can do a lot. So like I said, I've mentioned this earlier in our session. I'm going to just point it out in a few points. So if you want to remember them on the tip of your fingers or note it down, you can. So as a parent, first of all, please be very observant of your child's behavior. पर उस टाइम पे टोकना might not work all the time, है ना? Like we've come from a generation where टोकना was the first kind of a whip. ये कर आप फौरन टोक दो.
Parents का हक.
Yes.
Right.
So that is not true. Your child is an individual now that they are born and is a part of the world. The earlier, and also this is advice now, that baby talk थोड़ा avoid करना चाहिए बच्चों के साथ. You should try and talk to them or converse with them as adults. उनके cognitive development के लिए. So baby talk आप जितना ज़्यादा करोगे, जितना ज़्यादा you're gonna baby the kid down, उतना ज़्यादा the child will think ठीक है, because I'm a child I can get away with everything. ये भी एक issue है. For you that will create a problem, है ना? अब बच्चा tantrum throw कर रहा है and you'll be like अरे ठीक है कोई बात नहीं छोड़ दो, without addressing it, without having a conversation. So I'll give you an example that you can practice. तो अगर आपका बच्चा tantrum throw कर रहा है in a corner, what I have observed most commonly is they lie down on the floor. They just lie down on the floor and refuse to get up until unless you give them what they want. तो दो चीजें होती हैं, एक तो the parent given, and वो ऐसी सिचुएशन में करेगा जब उसको पता है कि पेरेंट्स के लिए ह्यूमिलिएटिंग होगा, यानी पब्लिक
शॉपिंग मॉल.
हाँ, शॉपिंग. Now they know that this is humiliating for my parent, so I'll do it then and there. अब you as a parent would get frustrated कि यार लोग देख रहे हैं मत करो, right? So many people are watching, stop doing this is not right. Or you'd be like ठीक है कर रहे करने दो. Now that is one of the ways, right? जब आप ये when you give into this behavior ना कि हाँ मतलब लोग देख रहे हैं कर लेते हैं, या फिर you take the extreme route कि जो रहे होने दो, both the ways are not very healthy to deal with it. What you need to do is, if your child is on the floor, sit down if there is place and be like, अच्छा क्या हो गया, क्या चाहिए, अच्छा ये चाहिए, why do you want it? As we already have it at home. Try and converse it out. अच्छा, so maybe what we can do is, we can do, so you do this much, I'll do this much. Try and find middle grounds as you would with an adult. किसी बड़े के साथ जब हमारा वो होता है kind of disagreement, we try and find a middle ground if we actually like that person, है ना? We be like बीच का देख लेते हैं यार, कोई आपका दोस्त बोल रहा है मुझे इस रेस्टोरेंट में खाना है, आप कह रहे हो मुझे उस रेस्टोरेंट में खाना है, तो maybe you decide कि चलो ढाबे में चलते हैं, दोनों रेस्टोरेंट में नहीं जाएंगे, let's go have chai, right? At the time you're supposed to treat your child similarly. Have a conversation first. Second, अगर child किसी टाइम पे tantrum throw कर रहा है, उस टाइम पे completely just be aware, show that you are attentive, but don't acknowledge it. लेकिन at night you can use stories as role play, in which you'd be like, there'd be एक बच्चा था राम, एक बच्चा था श्याम, or if you want to be more gender inclusive, include Sita. If you want to be more cultural inclusive, change the names. And sit there with your child and be like, the character A is a good character and character B is something who's done something which is not acceptable. तो पता है क्या हुआ कि उसने ऐसा ऐसा कर दिया and इसने फिर उसको बोला कि नहीं नहीं राम, हमें ऐसा नहीं करना चाहिए क्योंकि जब हम ऐसा करेंगे तो उसके repercussions हो सकते हैं. Now the child would, you are not directly telling the child that you've done something wrong. So the child is not like कि यार मुझे blame कर रहे हैं. But the child would understand the concept of honesty, sharing, tantrums, anything, right? Through role play. Role play is a technique parents can absolutely try. Then there are techniques of DBT. Consult a mental health professional, but there are techniques of DBT जो कि instant techniques होती हैं. बच्चों से you cannot expect mindfulness per se एकदम से. But कुछ techniques हैं जो आप सबकी use कर सकते हो मिलजुल के. जैसे कि अच्छा, and with kids you'll have to do it with them. आप बच्चों को ये नहीं बोल सकते जाकर के, जब से बच्चे को बहुत गुस्सा है, you'll be like जाओ पानी पी लो. The child might not do that, but you'd be like, चलो हम पानी पी लेते हैं. So you give the child a glass of water, you take a glass of water and then drink it, and the child would listen to you. Trust me. अगर आप उसके साथ चीजें करोगे तो बच्चा आपकी सारी बात सुनने को तैयार हो जाएगा, क्योंकि उसको लगेगा कि adult is paying attention to me and is doing the same thing. Again, imitation वाला part आ जाता है. Similarly, if you want your child to practice थोड़ी breathing exercises, do it with them. Don't ask them to do it. बच्चे ना बोल करके कभी कुछ नहीं करेंगे. It is not in their kind of like, कुछ बच्चे होते हैं बहुत ऐसे जिनको हम बोलते हैं सीधे शरीफ, है ना, जो कर लेते हैं बोलने पर. But again, you need to be like कि नहीं. Most of the time, it is participation is required, and that is why I noticed that kindergarten teachers are very active. They're always there around with the kids. The same goes for adult kids too. काफी time you need to have a very open conversation, open talk, discussion with teenage kids. बात करनी ही पड़ेगी. If you ignore the talk, ignore the subject, and just show that this is something I don't agree with. This issue happens in terms of masturbation is what I've noticed. With teenage kids, that is a very, very major issue. And they don't know what to do. And now they're very guilty. They're like, we're very guilty. We don't know how to stop. We don't know who to talk to. You need to be that adult in the home that koi ek parent, maybe both the parents can't do that, but one of the parents should be ready to have that conversation. If you're not, take that person, take your child to a mental health professional. They will have that conversation with your child. But having that conversation is important. they cannot start hating themselves and their bodies and their physique and everything that they're with, their psychology. They need to learn certain things. They need to unlearn certain things. They need to accept certain things. So absolutely, I think conversation is the key. With kids of a certain age, you have to do it differently. थोड़े बड़े हो जाते तो you have to do it differently. But at the end of the day, steps आप ही को लेना है. बच्चे से आप expect बहुत कम करिए कि वो लेगा. But the good news is, once you teach them certain behavior, so next time your बच्चा is angry, you're like, मम्मी पानी दे दो मुझे क्योंकि गुस्सा आ रहा है. So now you'll be like, हाँ मैं पानी. And this is actually proven. One of my seniors, a senior psychologist, she told me this. Yeah, she advised this. This is a DBT technique. And उसके बाद से now the child anytime she feels like her anger is piling up, she's like, "मम्मी पानी पीते हैं." And then she doesn't act out. So she has developed healthy coping mechanisms. So that is how you can do it.
Very good. That's beautifully sum up. Beautifully sum up. So there's a question. So we have covered this. What things parents can do ourselves for managing anxiety of the kids? There's a question. Hello, doctor. What should I do first before going to counseling session if child is showing some visible different behavior like extra mischief or showing unusual tantrums?
Before going to a mental health professional, what can they do at home, right? So, like I said, there are certain techniques that you can do, but you'll have to do it with the child. कभी-कभी अगर extra mischief हो रही है, you need to ask why. अगर एकदम से this is not a normal behavior for a child. If your child is not a mischievous child per se, then that is away from the normal, right? That is problematic. पहले पूछो कि अच्छा बेटा क्या चल रहा है आजकल, दोस्तों के साथ क्या चल रहा है, या फिर what are you doing आजकल, what do you play, छोटा बच्चा है, right? कि ये वाला तुम्हारा टॉय ठीक है कि नहीं, और ask more questions कि and before asking also notice कि यार मेरी लाइफ में तो कोई ऐसा disturbance नहीं चल रहा है that could percolate to my child. तो ऐसा तो नहीं है कि me and my spouse we are constantly fighting, or me and my mother, or me and my mother-in-law or father-in-law, because we live in a culture where the family should also be good. So notice all of that. The child could be doing this because of attention, because they want your attention. They are not getting it, so they act out. I mean, अगर आप देखोगे, so जब भी they don't see that, notice this, when you go to a friend's place and you're not paying attention to your child will break hell loose उस time पे. या तो रोना धोना, या and then you're like, घर पे तो नहीं करता है ऐसा, पता नहीं यहाँ क्यों कर रहा है, घर पे तो नहीं करता है ऐसा. At that time you're supposed to notice कि ठीक है, the child also wants your attention and acknowledgement. वो कुछ बता रहा है, पहले address the child and then continue the conversation that you're having. Please notice these tiny things. So without noticing the behavior, you cannot come to a solution. Without identification, for me to advise you something will be very, very wrong and unethical, so I cannot. But the best thing that you can do is make observations, take down a few notes, and then absolutely consulting is something that you'll have to do at the end of the day. Because only then you could come to a solution, because assessment needs to be done from the part of the mental health professional as well. Only your assessment might not be that valid. There is obviously a bias, you are the parent. There will always be a bias. ये वाली चीज तो ये तो normal लग रही है. But for a mental health professional, that could be something that could be of significance. So there is no quick fix, unfortunately. I know you were looking for a pill for that, like a quick fix क्या है, but there just is not. I will always advise go to a professional, क्योंकि उसके बाद you'll know what to do. Way better than just trying and a lot of things all together. जैसे हम स्किन केयर के लिए करते हैं ना, कभी-कभी सब कुछ ट्राई कर लेते हैं, डर्मेटोलॉजिस्ट के पास जाने को तैयार नहीं होते, डॉक्टर के पास जाने को तैयार नहीं होते. So it's something like that. And then eventually when the acne and everything is just way worse, then we decide अब चलते ही हैं, कोई option ही नहीं है. So don't do that with your child.
Very true. So my next question is, what is the upcoming field that would help children for managing their better mental health as they grow up?
Mm-hmm. Right. That's an absolutely amazing question. And actually I'm currently involved in a research of the same thing. So I don't know how many of you have heard of it. You absolutely would have social emotional learning. So in European countries, in the West, if you say, they are paying a lot of emphasis on social emotional learning and making it a part of children's curriculum till 12th grade. I don't know if you guys remember, we used to have this moral science or value education period back in school. We used to have this. The purpose of that would or should have been to inculcate certain habits in us, or certain behavioral patterns in us, or should have helped us deal with certain situations better, but ऐसा कुछ नहीं हुआ. Now, social emotional learning is the new field that is coming up currently in India, per se, or South Asia, uh, on a whole, right? So, it has 5 aspects. तो पहले they say कि self awareness is important. पता होना चाहिए बच्चों को कि हम कैसा फील कर रहे हैं. तो identification of so we'll always be misguided, and we could be like कि गुस्सा ही आता रहता है हर टाइम, when in reality the emotion could be sadness, or you could be upset, and you would be just exhibiting it as anger. Then there is self-regulation. Now that you're aware कि problem क्या है, you also need to learn how to regulate it. सिर्फ emotion recognize करके a part of it is solved. Then self-regulation will come. You learn how to regulate it. Then there is social awareness. To be aware of your social surroundings. Because mental health is incomplete without knowing what is happening with the people around you, how you're supposed to interact with them, how they are supposed to interact with you. This is where good touch, bad touch would also come. अगर कोई adult किसी भी बच्चे को, irrespective of being a guy or a girl or any other gender, अगर वो किसी तरीके से touch कर रहा है और it's inappropriate, please have that conversation with your child to save them from a lot of harassment and trauma in the future. Because once they recognize it at an early age, growing up, they'd know where to set a boundary. Okay, this is not okay. If their boss is just kind of patting, ऐसे हाथ रख के, अरे तुम तो मेरी बेटी जैसी हो. You're not my father. मैं तुम्हारी बेटी जैसी हूँ, but you're not my father. Don't do this to me. I have a father. You're not my father, right? So things like that. So that will come in social awareness. Then there is relationship skills. कितना सारे ऑफ अस आर ऑलवेज ट्रबल्ड विद हमारे हस्बैंड्स के साथ नहीं अच्छा चल रहा है, या वाइफ्स के साथ, या गर्लफ्रेंड या बॉयफ्रेंड, फ्रेंड्स के साथ, फैमिली मेंबर्स के साथ, नेबर के साथ, इनके साथ, उनके साथ, प्रोफेशनल रिलेशनशिप, बॉस के साथ. रिलेशनशिप स्किल्स सीखना बहुत जल्दी इंपॉर्टेंट है, एंड यू कैन लर्न इट एट एन अर्ली एज. Research has shown that a child can recognize emotions as early as 18-month-old. And at 24 months, they can identify emotions as embarrassment as well, disgust. So they know what is happening. You might think बच्चा ही तो है, but वो बच्चा ही नहीं है. Their cognition is storing all of it. Do not think that they are stupid. They are not. Okay. इसीलिए ये बहुत early stages पे social emotional learning, ये awareness बच्चों में डालना बहुत crucial है. आप ये खुद से भी कर सकते हो, क्योंकि अभी लॉकडाउन चल रहा है. Read up on what SEL is, है ना? There is a beautiful model given by KSIL. You can definitely go to their website and see it. They're doing some amazing research work worldwide. They have some, and then it's a non-NGO, it's an NGO, so most of their material is open and you can absolutely access it. Then Sesame Street का एक cartoon है, puppets है उसमें. YouTube पे आपको videos मिलेंगे. Sesame Street के puppets के साथ you can absolutely watch those with your children. बच्चे कुछ भी rubbish watch करते हैं YouTube पे. It's better you watch something that is good. So this is a recommendation that I can give you. Sesame Street के cartoons are there. They're really good. They are very well on the lines of social awareness, social emotional awareness. So that is important. But these are the things that you'll have to do with your child, and at an early stage. अगर आपका बच्चा बोल रहा है आपसे कि no, you know, अभी I'm kind of naked. I don't want to go out like this in front of my cousin. Listen to your child. Be like, ठीक है, हम कपड़े पहन के फिर जाएंगे बाहर. Rather than saying, अरे क्या, अभी तो तुम इतने छोटे. Don't do that. They understand what embarrassment is. Like I said, 24 months में they recognize it. So don't kind of dismantle their thought process. Do not do that to them. Listen to them. So yeah, this is something which is coming up, and I think that this will change, I don't know, a lot of things in time. But you are saying that mental health को अभी 1 decade लगेगा, इसको 2 decades लग जाएंगे. I'm telling you, that is the amount of time it will take for parents to realize कि ठीक है, ये एक curriculum है, because it will be a part of the curriculum eventually. It will have to, school में ही सीखना पड़ेगा, घर पे भी सीखना पड़ेगा. It will have to be holistic, right? But वो parents ने accept करना कि इसमें हम पैसे क्यों डालें, that is gonna take some time. कि हम क्यों डालें, but you will need facilitators for it, and people will have to eventually kind of pay.
True.
But yeah, this is very crucial.
Yeah. So when I came to your show, I've got a question, a very personal question, that do I get mood swings and how I cope up with it. I have a personal question from an audience for you. If you want, you can reply. If you don't, you can just.
Absolutely.
The question is, आपको कभी फील हुआ कि मुझे अगर बचपन में ऐसा होता तो आज ऐसा नहीं होता?
Oh, absolutely, all the time. I don't blame my parents for it per se, simply because unki generation mein, they did not have an awareness of mental health issues. I can't even understand the kind of trauma and how did they manage it. And I think, but अगर किसी के साथ कुछ बहुत ज्यादा हुआ है, please, that is not an excuse. Again, अगर किसी के साथ abuse हुआ है, I'm not promoting that, so I'm gonna say that. Then you definitely hold your parents accountable. But जैसे छोटी चीजें हो जाती थी, for example, I did go through some stuff at a young age. But I was very lucky because my brothers, my siblings, there was not a lot of age gap there, and they understood things better and were there. I had a very strong support system in my friends. So मेरा जो peer group था वो बहुत strong था. उसके अलावा घर पे भी it took me some time. So that disruptive age is class 9 to 12. For me it was 9 to 12 and I acted out a lot. I think it was hell for my parents too. I'm not just saying it was bad for me. I'm sure I made it very difficult for them. बट अगर उस टाइम पे कोई होता ना कि यार इसको किसी प्रोफेशनल से बात करा देते हैं, शी इज प्रोबेबली एक्टिंग आउट, बिकॉज माय बिहेवियर वाज नॉट लाइक दैट बिफोर दैट एंड आई कैन नाउ रिकॉल. एंड सो अगर उस टाइम पे somebody would have been like किसी mental health professional से बात करा देते हैं. I come from a very small town, Nainital. We didn't have mental health professional. I think last year we had our first psychiatrist in the town. So it's this recent. So mental health is something that was not to be talked about. And for a long time I was the only child. My elder siblings were really elder to me. Now the younger cousins that I have are really younger to me. So I acted out a lot as an only child. I did that a lot. So kahin na kahin, now that I realize it, of course, I think things could have been handled differently. But for that, awareness would have had to be there. And since it wasn't there, it took me a while to figure out. And I am a very anxious person. So I do have a lot of anxiety. And that is kind of one thing that motivated me to get into the field so that I could help somebody way better. Because I understand it from a personal perspective as well. So that helps me help people so much better. And now my siblings don't have to go through that because now they know that kuch bhi hai, just tell me what needs to be done. I'll take care of it. So you need to break the cycle somewhere. You can't just stay there कि you know कि ऐसी cycle क्योंकि बड़ों में चलती आ रही है तो हम में भी वही चले. तो next generation will suffer. But if you decide to break the cycle, that is what makes all the difference. And now I think that even my elders, so I'll tell you what changed. Since I became aware, I could spread the awareness to them. And now they know that this is an issue. So even when they feel like, yaar, beta thoda anxious lag raha hai, when I hear them use that word, I'm like, okay, so now they know what is happening. And I can help them too. So, you know, it's like things have, when one part of the circle heals, the rest of it heals with it. You don't coexist independently. So yeah, absolutely. I don't think anybody's there who hasn't had mental health issues growing up. At least in our generation, I just don't think that's possible because we kind of witnessed so many changes growing up.
I mean, mental issues were there definitely, but they were not addressed, especially when it comes to 90s kids. They were not addressed. They were not given back. They've been not valued.
Acknowledgement nahi tha because awareness hi nahi thi. Nobody knew what it was. For them, it was like you said at the very beginning, hey, you know, ये तो चंचल है. And now, अगर बच्ची चंचल है तो rest of it is down the drain. So that is what happened, right?
Yeah. No, I have seen parents covering up their child's behavior when they are publicly appeared or they appear for a party and they start throwing tantrums or violent behavior or repetitive talking. How are you? How are you? Who are you? How are you? So they cover it up. And he's very excited. He's very excited to be at a party. You know, he does like that. So
right.
Definitely this need to be considered, especially from the parents' part.
It does. Parents do. And even if you're just a caregiver, even an adult sibling can do it right now is what I feel. काफी बच्चों में age gap बहुत है. मेरे काफी clients हैं. One of my clients, she's 20. उसके siblings are right now 2-3 years old. So she can absolutely, like, if ऐसा dynamic है तो adult siblings can absolutely also step in.
Definitely. So we are here almost to the end of the session. I would like you to express your views, and you spared your time. I'm so much thankful to you from busy schedule. And as promised on social media, you appeared again on our talk.
Yes.
So
I think we kept our promise.
Right? Yeah. So, and what I'm expecting that you come again, and that this promise also I'm taking on the social media platform so that you cannot say no.
Right. I would absolutely love to. I would absolutely love to. I would love to have you with me as well. I think we need to have more conversations like this. But most of all, thank you so much for having me here, for addressing this. Like I said, that even though now people are talking about it much, it is still not enough. We need to talk about it till it kind of seeps in. maybe now some of the time I feel like लोगों को लगता है trend है, and कभी-कभी ना trend के चक्कर में damage ज़्यादा हो जाता है. I see so many um, I apologize for my language, crappy pages online, psychology facts, and then they be like, they just say random stuff. I mean, you would not say that about, something like arthritis. You would not give out random advice on that. So don't give out random advice on this. People do that?
No,
Oh my God.
I have psychological pose. The person who is very angry is very loving. My God, he has anger issues.
Oh
The
God,
psychological
absolutely.
10,000 likes. That crap has 10,000 likes. Nobody is trying to listen to the, professionals.
Sure. Oh my God, that is so true. There is this page which is, it has 88K something followers, 88.3K followers, and not one thing that it says has anything to do with psychology. It was like, if your girl cries a lot, then she is the one because she will listen to you. Marry her. And that was a psychology fact. And I'm like, what? If I don't even know how to respond to that. I was just so angry. They also did a poll on a teenage girl's picture, which infuriated me, and they asked if this girl is hot or not. I can never take that image out of my head. So please also be aware of these pages. But thank you so much for initiating this conversation, doctor. Yeah, you were saying something. Sorry.
This body shaming, the ritual we are coming up, the glossy skin, perfect body, perfect style, this needs to be stopped. Everybody
It does.
has a strong skin. Yeah, they're perfect,
Absolutely.
they're beautiful the way they
Sure.
are,
Right.
Yeah, and for that post, that you see that the girl is crying and all. Ask her, even if she's PMSing, don't propose. Still say no.
Yeah, I mean, ask her, have a conversation. I don't know why. So it's gonna take years and years for that, but I'm glad that you initiated the conversation. You had me over, so I'm like much obliged. And of course, last time you told me you have a very very hectic schedule. So again, I know that the amount of effort you're putting on your page is commendable. The amount of effort you're putting on social media is commendable, because trust me, we don't get much out of it. It is for the people who are watching. For us, it is more of, okay, this is something we've learned, let's do that. So I know the effort it takes, and you are doing a commendable job. I see you being very active, posting constantly, putting up very relevant information. So thank you so much for having me.
When we make a post, when any professional make a post, be it any disease condition or a clinical condition, what we do, we read 3 books. We take up a source. We have our clinical experiences, because we have been treating such a condition for we have seen hundreds of patients. And somebody is coming up with putting boom, anything, bogus, anything,
Right.
nonsense. They're literally pooping on a social media and getting likes and footage and shares. And we professionals are like, "Tumhe job chhod do kya?"
Right. Right. That's true. I think that does more harm, because we have to debunk those myths. When the client finally reaches you, or the patient finally reaches you, then you have to first debunk the myths about homeopathy, and then you'll have to restart again. So that takes a lot of time. बहुत effort लग जाता है. It's the same with mental health, I feel, at times.
I learned from your last session what we had. You said that unlearning is even difficult than learning.
Yes.
That was my takeaway tip. And I cannot get off from it. Even it's been more than a week, but continuously coming. It's very difficult to unlearn things, because it takes so long. Those things.
Right.
Yeah, so thank you so much, Miss Rai. It was so good to have you here. And we are so blessed, so obliged that you took time from your busy schedule, and you have covered a lot of questions. And definitely, those who have not seen our live, the video will be available on the IGTV. So I'll be sharing the link. Do share your feedbacks and your learnings. Next Sunday, we'll be back with another guest, another topic. And thank you so much once again. And this would be going a very happy week for me and those who have learned. Thank you so much. And those who want to refer or seek help from Miss Rai, I would be definitely sharing her email ID or the contact, so how you can consult to her for yourself or your kid, because she is an expert certified emotional wellness coach. Is it?
Yes, it is. It is an emotional intelligence expert too, along with my degree. So it works. Like you said, I did a lot of things. So some of it comes handy. Most of it comes handy, actually. Thank you so much. Thank you so much, Dr. Anam. It was wonderful talking to you.
Thank you so much, all the loving and patient audience. We'll see you next Sunday. Till then, stay fit, stay healthy. Hope you're fit.